In my previous videos, some people have reached out to me to say, oh, I'm looking to get a job in the care home, or they are moving from the NHS. They want to move from the NHS to the care home. People have got different reasons why they want to be in the care home or why they are leaving the care home and then seeking my opinion or my advice. However, this video is not about going to the NHS or going to the care home. I haven't worked with the NHS. I've only worked with the care home. So in this video, I'm literally going to explain to you what really happens in the care home. I have been there for over 2 years now, or close to 2 years. So I'm in a better position, or I'm in that position to spill exactly what's going on in the care home. I'm going to be telling you the truth and nothing but the truth, so that if you are considering making that decision, then this will help you choose whether you need to be in the care home or not. If you're seeing me for the first time, my name is Chidima. I live and work in the United Kingdom. If you've been following me in the channel, you know I'm a registered nurse. Without wasting so much time, let's get right into this video. So firstly, let's talk about the number of residents that you need to deal with. So if you are in the hospital, it's referred to as patient, client, depending on what you're doing for those people. And then in the nursing home, they are referred to as residents. For the benefits of those who are not yet in the UK, the care home is like a building where elderly people are taken care of, where they need to be taken care of by a nurse. They have nursing needs that need to be met. So if they haven't got nursing needs, they won't be in the nursing home. They will rather be in the residential home where they will have carers and senior carers take care of them. So anyone living in the nursing home have been assessed to have nursing needs, hence the reason why they are there. So let's just quickly start with the number of residents that you have to deal with. So normally it's always on the high side. In the hospital, I haven't worked with the NHS, but some friends have told me that they have to deal with 10 patients per one, 8 patients per one. But in the nursing home, you'll be dealing with 30 something residents, 40 something residents, 20 something residents, depending on how the nursing home or the care home is structured. Some people have a building with over 100 residents, and these 100 residents are not being taken care of by one person. There are different units, the nursing units, the dementia units. Some people are just having respite people in there. Some are on assessment units. So different homes have different structures in place. So, but basically, most of the time, people will manage people from 28 residents up to even 40 residents. So just know that you have a high number of people to manage. Now, one thing is, people ask, if you have 30 residents, are you going to be managing these people all by yourself? So the truth is that some of them are not really sick, while some of them are critically sick. Some of them are even on end of life pathway. So you are not necessarily or actively doing stuff for these 30 people, for these 28 people. Some of them might just be only their medication and then that's it for the day. Why some of them you have to make a lot of input depending on what is going on with them. So, and most times you have your managers, your unit managers, your team leaders, the care staffs are there to support you achieve this dream. So it's not like only you is going to be running the place, the whole day doing all stuff, personal care. No, you've got people who are going to be helping you. But the question is, some homes are not properly structured. Some are always short-staffed. While some other homes are making efforts to make sure that their staffing levels are adequate and staff do not experience burnout. So bear that in mind. You have a lot of residents to deal with. And this also takes us to the next one, which is working under intense pressure. So, right, when you come to the nursing home, the nurse is in charge of her unit. When you're on duty, you're in charge of your unit. Literally, all the multidisciplinary team, I mean the doctors, the specialist nurses, everybody that comes in to see these residents will have to go through you, because you are the one taking care of them. You know them better than they do. So before they make their input, they are going to be coming through you. So in a day shift, typically, you are going to be working under pressure. Most nursing homes, you work under pressure. You have your meetings to attend for the residents. You have the MDTs, the speech and language therapist is there calling you, the physiotherapist is there, the doctor is around. Everybody wants to see this resident at a particular time. And then remember, that is not all you have to do on the job. You've got assessments to do. You've got the care plans to review. You've got the medications to serve. You've got emergencies to deal with. The buzzers are going on back and forth. Emergency buzzer, you're chasing emergencies here and there. So if you are not ready to work under pressure, high level of pressure, but the pressure thing doesn't happen all the time. There are times when you have a smooth shift, everything is fine, no emergencies, not even one MDT, but for the most part of it, be ready to work under pressure. I hear people say that the nursing home is a routine, you don't get to learn anything and things like that. It's just the same thing done over and over again. But 90% of the time, it is true. So if you want to be, scaling up on your clinical skills, the nursing home might not be the best place for you. That's another thing to bear in mind, because you have your routines. At some point, you're going to get used to all of these routines. But however, there are a lot of trainings for you to do. Procedures come from time to time. In the nursing home, you still do your venipuncture, your peg tube feeding, you handle your syringe drive. There's a whole lot, there's a whole lot that can come in from time to time, but it's not going to be clinically consistent like the way it is in the hospital. So if you're looking about upgrading your skills, maybe the hospital, if you ask me sincerely, might be the place for you. Now, another thing to put in mind if you want to choose the care home or the nursing home is having to deal with the multidisciplinary team. So you need to know your stuff at your fingertips. You need to know them, because when they come to you, you expected that if you have 30 residents, you expected to know their fluid and diet levels, you expected to know their diagnoses, you expected to know all the medications they are on, what these medications do, any review that has gone on with these medications, the last GP input, everything. Literally, you have to know everything about this person to your fingertips. So when they come, they are liaising with you on what needs to be done. And that is the reason, let me say this here. If you are coming to the care home, you must act promptly in this MDT regard. Say, for instance, you have somebody who has a wound that has deteriorated. Now, it is paramount that you refer them to the tissue viability specialist, right? And now you didn't refer them. You did the referral after a week, after 2 weeks. My dear, when they come for that MDT, when they come to review that person, they are looking at the first day the wound started. They are looking at how long the wound has lasted. They are looking at all your assessments to spot the day this wound went bad. Did you refer at the right time? And if you didn't refer at the right time, if you have not done the right thing, they are going to safeguard you for not doing your job properly. That is why you hear people say that in the nursing home you can lose your PIN easily. Safeguarding is a thing. So if you're dealing with MDTs, if you're not ready to solo practice in dealing with MDTs, then don't look at the nursing home, because you're expected to know everything. Now, another thing I'm going to say is, if you're coming to the nursing home or you want to come to the nursing home, management of families. So every family, every resident family have their dynamics, right? People are going through stuff. people are going to lash out on you. Families are looking up to you for their elderly one to be all right. They're going to be asking you questions. Some are going to push you so hard beyond your limits. But all I'm going to say is, when it comes to handling families, don't just spill, don't just open your mouth and say stuff. If you have any questions that you can't deal with, I will advise you go to your manager. But if you're unlucky, your manager is not supportive, if your manager belongs to the group of people that will say, oh, you're a nurse, you're in charge, you need to handle it. I don't know what to say. But managing families is on another level. Now, the next point is documentation. Documentation in the nursing home is over the roof. Don't get me wrong. People working in different sectors, there are nurses all over the place, in the government settings, in the IT industry, everywhere. Some nurses are even working remotely. Basically, as a healthcare professional, documentation is the key. But permit me to say that the documentation in the nursing home is over the roof. Is over the roof. You have your care plannings to review. You have your assessments to do, your risk assessments. Before you pull up a bedroll, you will have to do what? Assess. Everything that you have to do, you have to assess. And it's even worse when you are dealing with people with dementia. Their mental capacity assessment for everything, for the call bell, for the medication, for literally everything that you have to do for them, you have to do your assessment. Incident reports, everything has to be reported. Falls, bruises, scratches, skin tears, everything is an incident. Abuse of staff, abuse of residents, everything is an incident. So you will spend a lot of time documenting. See, let me tell you, something you didn't document a year ago can come for you today. Something can happen and they'll go back to a year ago and you didn't document it. You're already in trouble. So that's why practicing in the nursing home is something that you have to be very diligent about. Documentation is very key. I always work with, so in my place of work, we have a to-do list. The night staff will print it for you. On that list, everything I have to do is on it. And if I have anything coming up during the shift that needs to be attended to, I put it down. Always make sure you have a jotter to write everything that you need to action on before you go home. So before you go home, you look at it and tick, everything, check, and be sure that you've done everything before you go home. That is the only way you will go home and sleep in peace. And even when you see a call coming from your place of work, you are not panicking because you know that you did your job rightly. And this issue of documentation, don't forget that even the conversations you have with family members, you have to document it, because family members can say something to you today and then they come back the next day, they deny it if anything goes wrong. So you have to be very careful. And look, don't take verbal instructions from any MDT or stuff without having a witness. Say, for instance, they call you over the phone to say, oh, blah, 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 I want you to do this, to do this, to do this. Tell them to hold on, that you need to get a second person to listen to the conversation. And then after listening to the conversation, you document everything that went on over the phone. That is the only way documentation will save you if you're working in the nursing home. Now, another thing that I have to let you know if you're thinking of coming to the nursing home is emergency and solo practice. You know, some people say that the reason why people lose pain in the nursing home is emergencies, having to handle emergencies on your own. But trust me, in the few years I've been in the UK, I've seen struck off according to NMC register. It's not only care home nurses, NHS nurses having struck off the register as well. So for me, I don't believe in that. I just believe that if you don't do your job diligently or you mess up your practice, you could be struck off for anything. It doesn't even have to be at workplace. Somebody can misbehave socially outside and still be struck off for misrepresenting her profession. So that is the thing. Solo practice and emergencies. So in the nursing home, we have the call bells and the buzzers. It's also in the hospital, you know. So dealing with emergency, most times you'll be running helter skelter, having to deal with emergency. But trust me, if you have a wonderful team like I have, emergencies will not be an issue, because once the buzzer goes off and there's emergency, everybody's running to that room to know what's going on. Your team leaders, your managers are going to support you. You need to call the ambulance, you need to do this, the paperwork. Personally, I love my current working place for that. If an emergency buzzer goes off, everybody's rushing to go and see what's going on. And once they get there, even if you need to transfer to the hospital, as you're on the phone with the ambulance team, somebody else is filling your transfer letter, somebody else is printing medication lists like that, somebody else is getting ready for CPR, you know, stuff like that. But this does not apply to every home. There are some homes that when emergency happens, everybody's standing by the corner looking at you, the nurse, to say something. They are looking at you to give them instruction on what to do. Do you get? So if you cannot solo practice and handle emergencies, because I've been in A&E before in the NHS where somebody pressed the emergency buzzer, oh my God, it's mind-blowing. The consultants, everybody was walking towards the scene of the emergency. I was like, oh, no wonder people want to work in the NHS and not the nursing home when it comes to emergencies. So that's that. And again, when it comes to emergency, make sure you phone the family, make sure you call. Sometimes the paramedics, I must confess, the paramedics sometimes, when you're telling them the degree of emergencies at times, some of them do not understand. Some of them do not understand, especially when it has to be with dementia. Let me tell you an experience I had. I had a resident that was ill. A colleague of mine called the paramedics. They came in and looked at this person, and they didn't take the person. By the next day, it was me on duty now, right? I got the handover. By noon, he was found dead, 5 minutes after personal care. Now the police is involved, somebody has passed on. But the good stuff was that this guy was sick the previous day, and the paramedics were called, but they never took this person. Because they will look at, I work in a dementia unit, I love dementia, to be honest. I love it. Some of them will look at it that because they haven't got mental capacity, or you are, sometimes, I'm sorry if you're paramedics watching this thing, this is how I feel. Sometimes they look at it as if it's fabricated. But you deep down know this person very well. You know this resident. You know that something is not right. But what do I have to do? You do what? Document. As the paramedics are leaving, ask them their names. Document it that they came and they didn't take the person. Just in case something happens, it has nothing to do with you. Inform the family that the paramedics came, they didn't take the person. Make sure all your observation, your news chat, everything is on point. File it very well, because you never know. That is one thing about nursing home. If you are even dealing with dementia people, it's very critical, because they can't tell you what's going on with them. You have to anticipate all their needs. And even when they have emergency situations, you also anticipate that what is going on here. It's an emergency. It's an emergency. So you must have to be very ready to deal with emergencies. Yep. You have to be very ready to deal with emergencies in the nursing home. Now, another thing I'm going to be talking about is end-of-life care. Look, all through my practice as a nurse, both back home and here, I've qualified now for over 2011 till now is how many years? It's 2024. That's over 13 years. I have never seen the number of deaths I have seen in the nursing home all my life post-qualification as a nurse. And trust me, it can be very traumatizing. Especially you have built relationship with the family, you've built relationship with the residents, you love them so much and stuff, you know, they are so dear to your heart, and then suddenly this person passes. I've been in a position within a space of 1 week, we lost 4 people. It was very traumatizing for myself, for the rest of the staff. Thank God for the beautiful managers we've got. They supported us mentally through all of these things. It was so hard. In fact, on one of the occasions, I couldn't even ring the paramedics when I found this person dead. And then my manager went, I can do the call for you. I can do the call for you. She took the phone from me and she made that call, because I was frightened. Like, it's so unbelievable. You just passed and then you wave somebody and suddenly you found them dead. And you know, such cases are tagged as unexpected death. So the police has to be involved, corona, blah, 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 blah. So these are the things. Dealing with end of life can be very difficult in the nursing home, verification of death and all of those things. So you need to be very, very prepared mentally when working in the nursing home. And again, I would say the good part is the money is good. The money is good. For me, if you have young children, I feel like there's a lot of work-life balance in most of the care homes. It's either you're a night shift staff or you're a morning shift staff. So you get to plan your life, and the pay rates are also good. For me, who I've never done agency shift since I came to this country, because I can't even do it because I'm always very exhausted. My off days, I want to have time for my children. You can't be chasing work, work, work. You also have to chase the affairs of your kids, except if you're single. And literally, if I choose not to do overtime shift in my workplace, if I choose not to do agency shift, whatever I get and whatever my husband gets, it's okay for us for the month, and we are fine. At this stage of my life, where I have young children to deal with, so I feel like the money in the nursing home also is good. So that's that for the monetary aspect. Now, another thing I will have to talk about is, there's something people don't talk about sometimes in the care home. I forgot to mention that during the time I was talking about emergencies, that is fire emergency. So if you're planning to come to the nursing home to work, make sure you understand the policy regarding fire management. Because if a fire goes off in the nursing home, the nurse is the first fire marshal before the fire service comes. Everybody's looking at you to give them instruction on evacuation, you calling the 999 and stuff like that. You must understand the fire plan of your care home. Understand every zone. Every care home have different zones. Understand the fire plan, the zone where your phone lines are, where you have to pick the phone, where you have to run to and dictate where the fire is, how to evacuate, the evacuation plan, the residents that you need to prioritize based on their mobility, their capacity, and all of those things. Because if anything goes wrong when there is a fire, you're standing in for it. And that is why most people do not joke about training staff in fire management. Most people do not joke about it. So make sure that once you get into that nursing home, know everything about fire management in your care home. Understand the policy. Understand everything literally. And above all, I must say, if you're coming from Africa, care home nursing is not something we really do back home. It's a nice experience. Am I going to leave the care home to the NHS? We'll do that when the money gets better, but not now. Because right now, I'm for the money. I'm being honest. There's no point having to not be able to pick overtime shifts due to childcare, and then I'm struggling financially. No, I'm not doing that. So if you're coming from Africa, care home experience is a thing. It's a good thing. The care homes are literally not so bad as it's presented. If you watch my video on my awful experience as a nurse in the UK, my first job ever, and listen to me now, you will understand that is a question of where did you go into, which people surround you as colleagues, the management that you've got. So don't let anybody give you some sort of bias about the care home. I'm also not promoting the care home, but if you feel like you need to go in there to get the experience, the good thing is when you're on sponsorship job to work in this country, you are not stuck. You are not stuck. If it's not working, leave. I always tell people, if it's not working, leave. If it's not working, leave. Don't let them ask you to leave. Leave before they ask you to leave. It's as simple as that. So that is it about the care home. If you have further questions, you can ask me in the comment section. I hope I've covered everything. In fact, there's a whole lot, honestly, that you're going to experience on the ground that I'm sure I've not captured in this video. But if you have further questions, you're looking to come from the NHS to the care home, you can ask me in the comment section. You're looking to move from Africa, Asia, wherever, to the care home, and you've got this job offer, you're confused and stuff like that, you can ask me in the comment section. I'll be more than happy to give you the response in the comment section. I would say. So before you go, don't forget to subscribe, share, like, share in your different WhatsApp groups and stuff like that, so that people can also watch and be able to make an informed decision. Don't forget to give us a big thumbs up so that YouTube can recommend this video to other people. I'll see you in my next video. Bye.